A Texas man recently died after contracting an infection he got after he went swimming in the Gulf of Mexico too soon after getting a tattoo. Joining us to talk more about the proper ways to care for a new tattoo and the risks from not following those rules is Dr. Richard Chaffoo. Thank you so much for being here. First of all,
Misha.
You know, tattoos, it's so commonplace. Lots of folks can really learn from this. But before we get to that, what happened to this man in Texas?
So Misha, the problem with this gentleman, unfortunately, he had a tattoo relatively recently, and apparently he developed what we call a cellulitis, or a soft tissue infection around that area. Probably got water exposed to it. The gentleman unfortunately also had cirrhosis. So he had, very immunocompromised, and what happened was he then went swimming in the water which was kind of brackish or salt water that had this organism, and the organism is actually related to the cholera organism, very virulent bacterial organism that got through the wound, and then he developed a virulent infection, something called necrotizing fasciitis, which is something the lay public knows as flesh-eating bacteria, which can be many different kinds of organisms. And then it just spread rapidly through his body, and of course, unfortunately, because the gentleman was relatively immunocompromised with cirrhosis, he did not survive the infection.
Wow. So he was in the Gulf of Mexico.
Yes.
There's all sorts of things he could have been exposed to, we can surmise. What about for people who are in swimming pools or lakes here in the States?
So the big thing, Misha, is that you want to make sure, certainly, that you can get infections like this and other bacterial infections if you've gotten a wound or an injury to your skin. You really don't want to get into that type of water. Pools, as we know, they're chlorine, they're relatively safe, they're inspected by pool inspectors, but when you get out from that environment, oftentimes there are bacteria that can get through a small break in the skin and literally can spread very rapidly. And unfortunately, we see that people that get very serious infections like this that are also immunocompromised, cancer patients, bad diabetics, people that have got cirrhosis, immunocompromised, elderly, very young, just don't have the wherewithal to fight an infection like that, and it spreads rapidly.
So what are the symptoms you should be worried about first? And then if you do get a new tattoo, it's summer, we're presumably going to be in the water. How do you protect yourself?
So the way you protect yourself is really, make sure to follow the instructions of whoever's done your tattoo. And again, you want to make sure it's a reputable parlor. You want to make sure that you keep that area clean and dry. You want to avoid any direct sunlight for weeks. And then you, obviously, if you notice an area that looks abnormal, the skin looks red, you don't want to itch it. You want to leave it alone. If you're going to get in any water like you're going to take clean yourself, you want to use a shower, not a bath, because you don't want to soak in dirty water. And you probably want to use some sort of a antibacterial ointment directly around the area of the tattoo. It acts as a water barrier and reduces a chance for any organisms to get in. And certainly if you start noticing, a lot of redness, swelling, skin lesions in the region of the tattoo, then you want to call your physician and get seen right away.
All right, very important information. Thank you for sharing it with us, Dr. Richard Chaffoo. Thank you.
Thank you.